The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, this is Nick Fusick with Child Care Aware of America. We're going to have a hour-long special webinar on the HHS proposed rules affecting the Child Care and Development Block Grant. And today we're going to be focusing on background checks and inspections. As some of you may know, last week we had a great presentation on background checks, which many of you may have seen, but unfortunately due to technical difficulties with our audio network, we're not able to hear. So we've included the background checks and inspections, which was our next webinar, into one presentation to make it more efficient and effective to talk about. So let me say, if you have any questions throughout the entire presentation, there's a question box. If you're having trouble hearing, we're making sure our audio network is working a little more efficiently this time. Or if you have any general questions about any of the content throughout the webinar, just post it in the question box and we'll try to answer it at the end. We always try to make sure we leave some time at the end of each webinar to go ahead and answer questions. So like I said, this will be an hour, but hopefully it will be succinct enough and help give you guys a better understanding of what's going on with the proposed rule. So let me start off with a general background on the Child Care and Development Block Grant. CCDGB, as it's more commonly referred to, is a $5 billion block grant program that provides funding to states, territories, and tribes. It is the primary federal funding source devoted to providing access to child care services and improving the quality of child care. It was originally started in 1990, and it was reauthorized and reformed in 1996 as part of welfare reform legislation, and that is the last time any major legislative action has happened on it. As you may have heard, there has been some movement on a reauthorization in this Congress. It was introduced earlier this month, and we'll be holding webinars that will talk more about the reauthorization bill, but let's talk a little bit more about the proposed rule for the purposes of this webinar. The proposed rule was released by Secretary of HHS, Health and Human Services. The Secretary is Kathleen Sebelius. She released it in mid-May 2013. It is part of the administration's plan for early education. To see the full rule, you can go ahead and follow the link here. We will provide these slides for you so you can make sure you have all the links and resources available to it. And one important thing is there's a 75-day public comment period which ends August 5th. So what this means is if there's a specific portion of the proposed rule that you think is great or not so great, or you have a general or specific comment about, the public has a chance to reach out and leave their impressions so that when the Department of Health and Human Services is writing the final rule, they can take them into consideration. So before we break into a little more about what's involved in the rule and more specifically about background checks and inspections, let's talk a little bit more about the federal rulemaking process, which is a pretty complex and a relatively uncommon thing to talk about. So the first step is a federal agency looks to see if there's a need that can be met through the regulatory process, and if determined as necessary, a rule is drafted. So basically they look if something hasn't been fixed and there's a big need for it, can they fix it through the regulatory process? And while they're drafting it, they'll usually consult external groups, anybody who would have a interest in making sure that something is done well. The next step is they then publish the proposed rule to the Federal Register. Once it is published, the public is then able to comment on the rule for a set period of time, typically ranging from 30 days to 90 days. As I said with the proposed rule from HHS for the Child Care and Development Fund, the comment period is actually open for 75 days, which ends on August 5th. Once the comment period ends, the federal agency then reviews the comments and revises its rule where necessary. So when looking at the comments that have come in, if a federal agency says, hey, we got a really, negative response on this part of the rule, we should consider revising it, they'll go back and revise the sections as needed. Once they revise, the different parts of it, they publish what's called the revised final rule in the Federal Register. After publishing the final rule, they then submit it to Congress and the Government Accountability Office, GAO, for review, which could take up to 60 days. At the end of that 60-day period, if there's no limitations, no restrictions from Congress, they then implement the final rule based on whatever date they set forth for enactment in the actual rule itself. So now for some of the nitty-gritty details about what's in the rule. So some of the highlights of the proposed rule include requiring providers to undergo comprehensive background checks, including federal and state fingerprints, minimum training requirements like safe sleep practices and first aid, practices to prevent shaken baby syndrome, and emergency evacuation or shelter-in-place planning, planning for disaster and emergency responses in child care settings, raising the eligibility period to 12 months, helping to ensure continuity of care for children and families, and enhanced resources to assist families in finding quality child care in their area, including consumer education websites with comparable quality indicators, a consumer complaint hotline, and better coordination with other services impacting families and children, like Head Start and IDA Part C, in the area that already do a lot of different services to make sure the child care piece of it is tied in to the community as a whole. So the first part we're going to look into is what are the current background check requirements. So under current law, the Child Care and Development Block Grant, there is no requirement for background checks, none at all. It doesn't require state fingerprint checks. It doesn't require federal fingerprint checks. So that's why we have recommended that a full background check is the key to providing protection for families and children. And a full background check, or full or comprehensive, includes the use of fingerprints for checks of the FBI criminal history record, use of fingerprints for state checks of the criminal history record, checking the child abuse registry, and checking the sex offender registry. This is important because state requirements on background checks vary widely. Only 9 states require comprehensive background checks for all licensed child care. The reality is that many states do not require fingerprints to check state and federal records. And given the transitory nature of the child care field, it's important that fingerprints are a crucial piece to any background check requirement. As it currently is, only 12 states require centers to conduct a full background check by using fingerprints to check federal and state criminal records, as well as checking the child abuse and neglect registry and checking the sex offender registry. At the same time, only 11 states conduct a full background check for small family child care homes. So the 9 states that require comprehensive background checks are out of those, or the remainder of those 12 and 9. And lastly, Child Care Aware of America's 2010 parent poll shows that more than 9 in 10 parents, 92%, favor proposals that would require states to conduct a background check using fingerprints on every paid child care provider caring for unrelated children on a regular basis. So this is going back to a lot of the need was there. Parents saw it, family saw it, and there's a lot of movement heading that direction. So the next thing we're going to look at is, okay, so the needs there, what's actually in the proposed rule. In regulatory language, it states that the building and physical premises safety shall, at a minimum, include the following: comprehensive background checks on child care providers that include the use of fingerprints for state checks of criminal history records, use of fingerprints for checks of the Federal Bureau of Investigation, FBI criminal history records, clearance to the Child Abuse and Neglect Registry if available, and clearance to the sex offender registries if available. So you may look at that, and I mean, I think this is one of the more straightforward sections of the bill. It's requiring providers, if they receive funding through the Child Care and Development Block Grant, to undergo a comprehensive background check that makes sure no criminal history records are missed. So I think there's a few things that I'd like to continue on with background checks. The cost of conducting criminal background checks will vary from state to state, but an FBI background check should only cost between $18 and $24. States currently have several methods for allocating the expense of background checks. Lead agencies defined under this rule may use CCDF funds to pay for comprehensive background checks and can potentially obtain funds from other federal sources such as the National Criminal History Improvement Program, NCHIP, and the Adam Walsh Implementation Grants. Lead agencies may also require that providers assume responsibility for background check fees as a cost of doing business. In some states, the child care facility pays for staff members' background check. Almost half of the states currently require individuals to pay for their own background checks, since the cost of the background check requirement is not borne solely by the state. The cost of implementing this provision will be diffused throughout the field. So, in other words, it's hard to quantify how it's currently done and what potential impact it could have on providers and different families, providers, and states, because it's done so many different ways across the nation. While this may represent an additional burden for some child care providers, current practice indicates that background check expenses are already considered a reasonable cost of doing business within the field of child care. In addition, states can implement systems to facilitate making background check verifications portable, which would help to reduce the cost of providers in an industry with pretty high turnover. So there's a lot of ways for states to make this feasible without needing significant and considerable additional resources. So one of the next things I want to go into with background checks is the Department of Health and Human Services is specifically seeking comments on whether requirements for a comprehensive criminal background check should also be applicable to other individuals in the child care center, such as food service and office personnel. In addition, on whether other individuals in a family child care home that provide services to children receiving CCDF subsidies should be required to undergo a background check, and at what age. One thing we'd like to point out is currently 43 states require some type of background check for family members 18 years of age or older that reside in a family child care home. So like I said, HHS is specifically seeking comments on that, and if that's something that, you've looked into before you've conducted research, or something that your field or members or partners or network has felt strongly about in the past and has worked on, it's something that HHS is specifically looking for insight on. So a little bit more about inspections. Under current law, the Child Care and Development Block Grant also contains no requirement to inspect child care providers. So, we believe that inspections ensure that those providing a public good are meeting minimum standards. Without inspections, we have no way of knowing whether the service or product is really safe. Most major services today have regular inspections, and these include restaurants, hospitals, road and bridges, and public buildings. The other thing is even services that are more consumer-oriented are also inspected, which which could mean dog groomers, beauty salons, and something as simple as the food available in grocery stores. We believe very strongly that children deserve the same level of protection, and Child Care Aware of America believes that all child care programs that regularly care for unrelated children for pay, in other words, as a business, should be licensed and should be inspected regularly with inspection reports posted on the internet for easy access for parents. So kind of to see where we're at currently, since there is no requirement, what are states doing on their own? 21 states conduct inspections of center once a year or less frequently. So at most, there's 21 states doing it once a year. 8 states actually even issue a license to family child care homes without conducting an initial inspection. There are some states that actually only inspect child care centers once every 5 years. There's some states that inspect child care homes every 5 years, and there's even a state that has inspections of family child care homes once every 10 years. There's even 2 states that don't do inspections at all because they do not license family child care homes until a certain degree, until a certain threshold of children served is reached. For child care centers, 27 states already post reports on both regular monitoring and inspections due to complaints on the internet. For family child care homes, 24 states post reports on both regular monitoring and inspections due to complaints. And lastly, Child Care Aware of America's 2010 parent poll shows that 88% of parents favored requiring states to inspect all child care programs, including those operated from people's homes who are paid to provide care for unrelated children at least once a year. So looking at these numbers and looking at what we saw from parents in our polling, there's definitely a strong need that HHS obviously was made aware of as to where they can go from here. So let's look at the next part. So as straightforward as the background check piece was, you can see this piece has a little more regulatory language, which basically breaks down to 5 main areas. First off is compliance with local health and state and local health, fire, and safety building codes, which must include ability to evacuate children in the case of an emergency. And this is something they've stated must be determined prior to child care providers serving children receiving assistance. The next section, or a few sections later, states that lead agencies shall certify that procedures are in effect to ensure that providers which receive assistance by federal funds comply with all these local health and safety requirements, including those described in the language. Some of the things that must be included are unannounced on-site monitoring and annual unannounced visits. Another piece is states may not solely rely on self-certification of child care providers in this way as they have in the past. They're looking for more specific documentation to help verify what requirements have and have not been met. The next piece is requiring an unannounced visit in response to the receipt of a complaint pertaining to health and safety of children. So if there is a substantiated complaint, there needs to be an inspection that follows up with that. And lastly, it must require child care providers of services to report any serious injuries or death of children occurring in child care. So just a little more about what's there. As I said, states would be required to establish the following monitoring procedures for providers serving children who receive CCDBG funds. that include unannounced on-site monitoring for compliance with health and safety requirements, self-certification, additional verification, unannounced visits in response to complaints, and better reporting of deaths or serious injuries occurring in child care. So these are some pretty big changes happening to the background check and inspections processes as they currently exist, which I've mentioned before are non-existent, if you will, or minimal. Once again, HHS is seeking comments on certain areas of the inspection piece of it, in addition to the background check piece. They're curious as to what the field feels is the appropriate phase-in period for providers already serving CCDF children to meet health and safety requirements. So how long should it take for providers to meet these new goals, meet these new measures, and at what point should they be inspected to ensure compliance with these new measures? So they're looking for comment on that, and they're also trying to figure out whether the recommendation that providers should receive initial monitoring visits and at least one announced visit annually is appropriate and feasible. So what the field feels about how these are current, what the resources available are, and what is the best way to handle this. We've always been big advocates of recommending that there needs to be at least one unannounced visit annually, and there by all means need to be an initial visit before licensing to make sure that we know the type of quality settings that these children are in. So the next thing I want to bring up is some resources we currently have on these issues. The first thing you'll see is one of the better spots I can point you towards. You can find everything there. That will help you break down some of the roles, some of the proposed, finer points of the proposed role. It's our core issue page. We've dedicated a page just to some of the background and more specific pieces about the proposed role. Additionally, the next piece you'll see is a one-pager on background checks, which you can also find on our core issue page. Also on our core issue page, you can find a little more information about inspections, as well as training and quality and consumer education, which will be covered in additional luncheon room webinars in the future. The next resource you'll see is ACS, Administration on Children and Families, Child Care Rule page, which has a bunch of great resources, including a link to the actual rule itself, what changes were made, and their press releases and comments on that. And they also have a section on frequently asked questions. And the next link you'll see is the link to be able to comment on the actual rule itself. So if you follow this link, it'll take you to where you can make the comments online. The next one is, as I mentioned before, the Administration on Children and Family has provided some insight into frequently asked questions that they have been fielding. And the last two are just kind of some more general takes on it from both ACF and from our policy blog about what the rule does and what we recommend going forward for the rule. At this point, I'm going to open it up a little bit more for some questions from our participants out there. If you have any questions regarding anything revolving either the rule itself, the rulemaking process, submitting comments, background checks or inspections, or any kind of other materials that may be helpful, or anything we can do to really helpful, there's a question box there that you can type it in, and we'll try and get to it. Oh, this is a great question. Will we send the PowerPoint so that we can access the links to the resources? Absolutely. We try to make it standard practice to make sure that after each webinar, the PowerPoint slides will be available online in the same location where you registered for it. So if you go to our Lunch and Learn page on the policy, shortly after the webinar has completed, you can find it. It will be posted there, and all of the links will be active, so you don't even have to worry about copying and pasting into your browser. You'll just be able to follow it straight from the PDF. Oh, this is another great question. It's asking for more information on the comment process. So as I mentioned, you have 75 days to comment. That starts from when the rule was officially published in the Federal Registry. What happens from there is you go to the link that we mentioned, which is the one right there where it says to comment, and it's almost like filling out a basic form, and there's a few ways to do it. We will be providing some sample comments to help, help with messaging, help with format. We understand it's a newer process for most people. It's not something that a lot of people have had exposure to in the past, just because it's not something that in the child care field has happened since 1998, which was the last time they've made edits to the statutes. So we're looking to help out with that if you have questions throughout that process. Maybe if you have messaging questions or even logistical questions, we like to try and be helpful on that. Okay, so this is a great question, a little more general, but what's the difference between the proposed rule and the reauthorization bill that we've heard about? So how are they different? What, should we still support this with the reauthorization bill? So basically, let me start off by saying the proposed rule comes out of the federal agency, and it's definitely separate from the reauthorization bill in Congress. There's different pieces which they both impact. We will go into the CCDBG reauthorization bill in later webinars and lunch and learns, and we will make sure we communicate with everyone as to when they are. But we want to make sure we're being supportive of the rule, and we want to make sure that going forward, we're supportive of both, because both are great steps forward. Things that haven't really happened in the past are happening at the same time, and it's a great deal of it's a great deal of appreciation for our membership, for our field, and advocates for moving stuff like this forward. Let's look at some of the other questions we have. Does Child Care Aware of America know of organized opposition to the proposed rule? Has any state voiced their opposition? This is a very important question. There's been some minor opposition to the rule, mainly from those who believe in less government. That's the initial one. But currently, any organized opposition is relatively minor, because right now many advocacy groups realize the importance of these minimum health and safety measures to make sure all children are safe in care. But we do want to stress the importance and emphasize how crucial it is to make sure you have positive comments in addition to any. We want to make sure any comments on there are done constructively. Let let me phrase it that way, because we want to make sure the Department of Health and Human Services, the Administration on Children and Families, and the Office of Child Care are aware of our appreciation for what they've done, and we want to make sure the positive comments by all means outweigh any negative comments. I cannot stress how important it is that we are looking at this as a positive development. Let's see what other questions we have. Just a general question about the cost of background checks. It's a hard thing to quantify at this point in time what impact the new rule, if implemented, what impact that would have on centers and homes and states and current practices. One thing the proposed rule has made sure is that although it's requiring it, states still have the flexibility to handle the administrative aspects of the background checks requirement in their own way. So if your state has handled it a certain way in the past, the proposed rule is trying to make sure that you're not going to be significantly affected in the way you do it. If your state hasn't required background checks in the past, or comprehensive background checks, or there's new parts added, that will be something HHS and the lead agency in a state work together on making sure it's handled effectively and efficiently and with the least amount of strain on resources in that state. So here's one thing I wanted to mention real quick. Tonight, or I take that back, next Tuesday at 7 p.m., the Department of Health and Human Services, in coordination with us, are hosting a webinar on the proposed rule as part of our Child Care Aware Parent Network. And it's going to be an hour-long webinar, and it's going to look at a little more generally what the rule is, what they're looking for comments on, and what parents, providers, and advocates can kind of do to help them help everyone. So if you're interested on that, you can find that on our Child Care Aware Parent Network page, and in our communications, there's been links for that, and that will be next Tuesday at 7 p.m. Oh, this is a great, really important question. How long will the fingerprint process take, and will it slow up the hiring process? This is something we've heard from some other advocates, especially providers, because they're concerned. They want to make sure they don't miss out on preferred candidates and qualified candidates, and they want to make sure they can provide care in a timely fashion to parents. And the process is, the important thing to remember is that many states already have the process in place, so it will be on providers and staff to make sure that it's being done in a timely manner. But the process itself, at most, will take up to 10 days. That's what we've seen to this point, and that's what we've seen going forward. That's what we've been led to believe will be the pattern going forward. Oh, let's see, lots of questions coming in. Does the proposed rule permit lead agencies to contract out inspection visits and monitoring to other agencies such as CCR&Rs? So let me take that and say yes. The one thing that is important is that when writing this rule, HHS stressed that they want to make sure states have flexibilities because they understand the limitation of current resources, especially for quality initiatives. So there will be a decent amount of flexibility in determining how states decide contracts, what abilities they have to license out contracts for different parts of improving quality initiatives. Just an example, which we'll talk about in a later webinar, is technical assistance. I'm just using that as an example because I think it's the most salient example of states contracting out to resource and referral agencies where R&Rs have the expertise and have the ability and the capacity to kind of handle these. This is another great question. Let me redo it. So, what would stop a person from being licensed in a background check of an individual in a home? What could possibly stop licensing as far as criminal past? If it was many years ago, would the background check stop licensing? So the way the rule is it would be for a major felony. And they define what the major felonies are. These include murder, child abuse, sexual assault, high theft. So these are the things that we have recommended in the past as being absolute must stops as far as background checks goes. These are the bare minimum, in our opinion, offenses that should disqualify a provider from caring for children. There is, in the thing, a appeals process for different crimes. A person who undergoes a background check, and if it came back flagged, could request an appeals process that could look at different areas and make a case-by-case basis. But there are ways to make sure that we're not excluding or we're not, discriminating against different groups who may have a higher incarceration rate, but we're making sure that children are safe, and that's what it really comes down to. Major crimes or major felonies are a good first step as far as making sure children are in the care of people who they should be. Let me look for it. We can maybe take one or two more questions. Let's see. There's quite a few. This is just about implementing inspections in a state that already has inspection requirements. So as I mentioned before, 21 states already do inspections around once a year. So how will that change? It's going to be difficult to break it down on a state-by-state basis based on what each state has. This is just setting the minimum. So say a state does inspect homes and centers 4 times a year, which some states do. There are some states that are ahead of the curve in that regard, and this wouldn't change that part of it. So they would still be able to license or to inspect 4 times a year. This is just making sure that states who don't inspect at least once a year are coming up to that minimum standard to make sure they do it. So if a state does it 4 times a year or inspect on a wide set of categories, it really wouldn't affect that. What it would impact is the states that don't currently have inspections. Well, let me finish up by saying I appreciate your participation in this webinar. If you have any questions about the proposed rule or moving forward from here, please feel free to contact me via email. I'm always happy to talk policy, proposed rules, or the Child Care and Development Block Grant Reauthorization Bill. We once again appreciate your patience regarding the technical difficulties we experienced last week. The slides will be online as well as a recorded version of this webinar. And we hope you have a great day. Thank you very much.